The Iranon District Hospital started its operation on March 3, 2022. The district hospital shall serve as one of the principal facilities in the 1st District of Maguindanao. It shall have a minimum bed capacity of 70. But currently, the hospital is operating with 25 bed capacity. In terms of human resource, the hospital has a total of 102 approved permanent positions. The allotted MOOE is approximately 1,500,000 pesos monthly, which 75% of this amount is allotted for the salary of the contract of service employee. Out of 102 approved permanent positions, only 4 was being filled up and appointed last February 1, 2022. For the current year, there are additional 24 positions being filled up and they were appointed last February 1, 2023. In order to cover the shortage in human resource, the hospital is forced to hire contract of service employee. As mentioned above, the hospital is currently operating with 25 bed capacity. This is because of the limited space of the hospital building and the insufficient allotted fund to support the hospital operation. Thankfully, the BARM government allotted 15 million pesos for the construction of a bigger building in the newly acquired land in the municipality of Parang. In order to be fully operational and generate income, to support the hospital operation and to level up the hospital from infirmary to level 1 hospital with 75 bed capacity, the hospital need medical equipment such as conventional X-ray machine, chemistry analyzer, centrifuge machine, PT-APTT analyzer, urine analyzer, electrocautery machine, anesthesia machine, portable ultrasound, portable built-in operating room light, biorefrigerator, electric hydraulic operating room table, ultrasound printer, electric bed, patient cardiac monitor, drop lights with wheels, emergency car trolley, and clinical trolley. To minimize expenses for the salary of contract of service, appointing all the remaining 74 permanent positions is necessary. Before, the right to health is not fully enjoyed by the people because of many reasons, and health is the least priority of all. But now, through the collaborative efforts of IDH staff, government and non-government sectors and allied forces, though much improvement is still needed, the situation, however, does not discourage health managers and implementers, but instead challenged and inspired us to think of other ways and means to contribute to health improvement, especially the healthcare delivery system. The great challenge also lies on how to involve other stakeholders' supports and contribution to attain the planned health goals. Our salute to the active IDH staff who played important players in attaining the best for the good people of Iranon District. As we believe, health is a basic human right. Every man, woman, youth, child, pregnant, senior citizen, and person with disability has the human right to the highest attainable standard of physical and mental health without discrimination of all kind. The impact of fake news in the community is one of the major concerns in different sectors, especially public health, as it can greatly deplete the effectiveness of programs, actions, and initiatives aimed at citizens' health, advertising, and well-being. This reckless false information deliberately disseminated to deceive people, the consequences of this information overload to the public and spread uncertainty, fear, and anxiety. Therefore, we Iranon District Hospital warriors under the leadership of genuine, people-loving, and the man of distinct vision and fountainhead of illuminating ideas, Dr. Harris MACAPEGES, dedicating tremendous effort aimed at providing evidence-based information and advice to the public regularly. Through daily ward class, monthly celebration of DOH programs, and deliver services close to the doorstep of the constituents through outreach program. Iranon District Hospital conducted and participated 21 medical missions in collaboration with other allied agencies. We have catered 1,453 for Operation Tuli, 97 minor operations, 1,160 consultations. The humble and devoted staff regularly doing the best to carry out the mission and vision of the hospital. It has been a religious routine for us to cater the demand of people to maintain life. All was made possible by the support coming from our allied agencies, MSSD, local government unit, Ministry of Health represented by our beloved Minister Dr. Rizalde Piang, and IPHO Maguindanao. All patients catered at outpatient department and admitted patients will be enrolled to point of service to PHIC benefit with no balance billing and free of charge to all. We have many activities to entice people's participation. The IDH staff constantly doing their best for our quest to deliver the best quality health services and health awareness to our people. A list of priority issues was identified which emanated from discussions and consensus with hospital unit heads as part of planning process. These include resources for health, the human resources, health facilities and equipment, health emergencies and surveillance, procurement, supply chain and logistics management, and health governance. Based on our records, the burden of disease tilts increasingly towards respiratory diseases, non-communicable diseases such as cardiovascular disease, diabetes, and hypertension. Injuries, accidents, and some infectious disease such as measles and dengue are also on the rise.